السلام عليكم ورحمة الله. مرحبا. الفيديو التالي مقدم لكم من هايدي نديري، استشاري أول في Compliant Medical Devices. نأمل أن تجدها مفيدة. لا تتردد في الاتصال بنا على البريد الإلكتروني موضح أدناه إذا كنت بحاجة إلى أي معلومات إضافية.
Today we're going to cover clinical equivalence. In this video we are going to cover clinical equivalence per Article 61 and Annex 14 of MDR. In other words, when a manufacturer bases the clinical evaluation of their medical device on clinical data relating to a separate device, which can be one made by themselves or by another manufacturer. We will consider the ways in which the claimed equivalent device must be the same as or very similar to the device under assessment. We will also go through what an EU notified body assessor would be looking for within the manufacturer's technical documentation when it comes to clinical equivalence. One of the drivers for wishing to use clinical data from an equivalent device is to avoid undertaking a clinical investigation when it is not necessary to do so. Although clinical investigations are a very common way of gathering clinical data for a medical device, and one might think that running a clinical investigation is always a good thing to do, this is not quite the case. Clinical investigations are not risk-free. In a clinical investigation, we are often evaluating a medical device that is new or incorporates novel or untried materials or technologies. Because under the regulation, patient safety and well-being is always paramount, we only want to run a clinical investigation when it is unavoidable. Clinical data via the equivalence route offers one way of gathering valid clinical data from an equivalent device on which to base our clinical evaluation. There are, however, a number of provisos to taking the clinical equivalence route. Most importantly, the two devices must be very closely matched in certain respects. And it is the responsibility of the manufacturer to demonstrate the fact that the two devices are closely aligned in the technical documentation for the device under assessment. As defined in paragraph 3 of Annex 14 of MDR, the key respects in which demonstration of equivalence must be provided are in terms of their biological, clinical, and technical characteristics. Starting with biological characteristics, the claim equivalent device must be the same as a device under assessment in the following areas. Firstly, the equivalent device must contact the same human tissue or body fluids as a device under assessment. It must also be made of the same substances and/or the same materials. Finally, the equivalent device must be used in a similar manner and for the same duration of time as the device under assessment. For clinical characteristics, the claimed equivalent device must be similar to or the same as the device under assessment in the following areas: a similar patient population in terms of age, anatomy, and physiology, the same kind of user population, the same clinical condition or purpose, applied at the same site in or on the body, and a similar clinical performance. When it comes to technical characteristics, the equivalent device must be the same as a device under assessment in the following areas. The device must have similar principles of operation, a similar design, similar deployment method, similar condition of use, and similar priorities and specifications. Demonstrating equivalence must be based on scientific evidence. The manufacturer must show evidence that they have access to data relating to the device for which they are claiming equivalence. And a notified body assessor will expect to see scientific evidence supporting equivalence claim. Let's explore equivalence by taking an example of a very simple device, a wound dressing. If the manufacturer uses another wound dressing as an equivalent device, then, as per paragraph 3 of Annex 14 of the MDR, the two devices must be the same in terms of their clinical, technical, and biological characteristics. In this example, the device under assessment on the left has a different clinical claim to the potentially equivalent device on the right. In other words, the equivalent device doesn't have the same clinical characteristics as a device under assessment. It will therefore not be acceptable for the manufacturer to rely on equivalence as a clinical data route for their wound dressing. In summary, in this video, we have learned what criteria to be followed in order for equivalence to be demonstrated. We have gone through clinical, technical, and biological characteristics, and we have learned that a manufacturer must base these justifications on scientific evidence, which means they must have access to data for the device they are claiming equivalence to. Thank you.